Hello, this is Dr. Adam Kopsky from Advanced Rehab and Medical, and I'm coming on today to go over a comment that we had on our previous blog. A couple weeks ago, I went on and just asked to get some feedback, and we actually had one comment, and so I'm going to read that right now. The person was named Christy, and they asked, I have a TENS unit at home. Will that help my back pain? Could you please address this? And so that's a really good question. I always love TENS units if you have pain, but the one thing I want to discuss there is that we have a lot of patients come in and they'll ask, well, I have a TENS unit at home, and you do that in the office. However, what they're actually discussing there is between a TENS unit and a muscle E-stim that we do in the office, and they're completely different therapies and have different therapeutic effects. And so one thing to address this question is, yes, a TENS unit will help, but it's just temporary. But it's a safe alternative for medication because it doesn't have all the side effects. So a TENS unit, what it does is when you place those electrodes anywhere in your skin, either the back or neck, it'll actually numb the pain because it blocks the nerve and just affects the nerve itself. So what happens is you feel good for the 20 or 30 minutes you have it on because you're not in pain, but when you take it and remove the pads off, the pain comes back. Just like a medication would, once it wears off, the pain comes back. However, it's a safe alternative because you don't have all the side effects you typically are seeing with your medications. So by all means, that will help if you're on medications to get you some relief. However, going on to the difference between the TENS and the muscular E-stim is that the muscular E-stim that feels similar that we do in the office affects muscles, not the nerves. So when we can affect the muscles, what we're doing is helping them contract and relax to get the swelling and edema out of the area as well as relax them. This is actually getting progression and affecting actual change in the body rather than just numbing the nerve and taking the pain away temporarily. So I hope this helps. If you have any questions, please comment on this video below. We'd love to see feedback from anyone that has issues or questions that they're concerned about and see if we can help. So I hope you guys have a great day and look forward to reading your comments.